Well, as Senator Barrasso pointed out, the border policies aren't getting better and the consequences are getting worse. No longer worried potentially with that CDC rule letting more people into the country, but also the problem of taking money that's been appropriated to fight COVID and to have to use it now to spend at the border. Another $823 million this week was transferred, most of it from the National Institute of Health, money that had been appropriated to fight COVID, now going to deal with the issue of unaccompanied children at the border. Almost $4 billion has been transferred into that account already, and $1 billion of that $4 billion was from COVID money at the National Institute of Health. The other thing we've got to be more concerned about, obviously, is the vaccine. I was just in Missouri. Our numbers are not where we'd like them to be. In early June, we were having about 400 new cases a day. Now we're having something closer to 1,400 new cases a day. And at every event I was at, I encouraged people to get the vaccine unless their doctor had specifically discouraged them from getting the vaccine. We're in a fight now here and around the world, frankly, where it's sort of vaccine versus variant. The way you don't have all these new strains is you don't give the virus anywhere to live and become more resilient. That's the case here. You need to get vaccinated, even if you think you don't have an individual problem. We've got to stop having places for the virus to begin to mutate, to begin to develop a different variant. Frankly, that's the way our country, which because of what we did with warp speed under the prior administration, we're going to have a lot of extra vaccines, and we should be interested in getting those vaccines to other people in the world. Nobody will benefit from having this virus continue to develop other variants. So it's vaccine versus variant, first at home, and then whatever we can do to help fight that same fight all over the world. We are not nearly in as bad a place as we were, but we're not nearly as good a place as we would all like to be.